Before starting, I would like to thank you for taking the time to review and listen to my speech. I do apologize for coughing throughout the speech. I'm a little sick at the moment. My name is Killian Mills, and today I would like us to explore a viewpoint that sometimes receives little attention that while drug misuse is dangerous and wrong, moderation and medically supervised use when required can be very appropriate and advantageous. Advantageous meaning to better benefit. Um, Every year, millions of American citizens are prescribed prescription drugs such as pain relievers, sleep aids, and stimulants for legitimate medical purposes. One great example is my stepfather just got prescribed medical use for um, THC, or otherwise known as weed or marijuana. He does not use it, but it is because he is 100% disabled through the VA. It allows soldiers or veterans to better sleep or get a relaxation from damage they've taken throughout the wars. Um, Prescription drugs can be very effective in relieving pain, treating diseases, and enhancing the quality of life of people suffering from chronic pain, injuries, or other conditions. However, when some people misuse them, the misuse leads to the degradation of the use of such drugs in general. Again, teens our age use medical marijuana or THC to get high, cure boredom, etc. In my view, this is wrong, as if most people would also view wrong, and must be placed in its proper context of drug use for legitimate medical needs as opposed to that for illegal or immoral uses. Um, when THC gets into the wrong hands, it can be improperly distributed. A lot of people use it to get a high, make some easy money on the side, and that puts a very big and large dampen on drug use. Um, there are many uh, legitimate uses for controlled drugs in medical practices. If prescribed and administered correctly, controlled drugs can be very beneficial for pain or illnesses and can be taken safely and effectively. In fact, many people rely on controlled drugs in order to live normally and productively when suffering from chronic conditions or painful injuries. A lot of times in injuries, many individuals will get prescribed an opioid. Sometimes it can be used for good. Sometimes people can take it out of hand and get addicted. Um, it can be very dangerous to generalize that drug use is negative and unethical. Again, backing that up by the example I just stated. Abuse and misuse, on the other hand, carry potential health and social risks that may lead to concerns for moderation and regulation use. Lower rates of non medical use of prescription opioids are reported in the literature. In one survey of large numbers, it was observed that 4.5% of adults reported non medical use per year, and about 13% of those had any disorder involving possible use of opioids. I believe that is Compton ETAL 2024. Rates of use disorders for any opioid are observed to be higher in those persons who misuse it. I apologize. In fact, it can be highly useful and advantageous for society to have a balanced and understanding attitude towards such use and misuse. Thus, having the capacity to distinguish between the use and misuse of prescription drugs can be very advantageous in that it prevents any type of stigma on those individuals who use such prescription drugs for their medical conditions. In conclusion, drug use is anything but good versus evil, while on one side of the spectrum lies proper use of drugs for healing and relief. On the other side lies improper use that brings about dire side effects. It is important that we promote and honor those who use drugs properly while of disproving and preventing drug use in the wrong manner. Thank you very much.